Hello and welcome to Seven Sentinels. This is Grand Master Class and I am Peter Simon with you. Today we are going to deal with writing. The task taken for today's lecture is for the medical professionals, medicine, and this is not targeting only for medicine because we are not bothered about the letter in specific terms, but in generic terms, we're bothered about sentence construction, passive formation, avoidance of personal pronouns, eliminating irrelevant information, refraining from using redundant information, including the most important or vital information to reach the target audience. So don't bother about what type of letter it is, whether it is which profession. We are not bothered. We are bothered about many different things. So this is equal for all the professionals. Just taking, in Indian tradition, we have people eating from banana leaves or from the plates. Different styles we have, but eating is food everywhere. So traditions change, but eating food is one and the same. In the same way, professions change, but the subject is one and the same. Right. So don't mind the example, mind the sentence constructions. Yes, here is the letter. And just have a glance. This is the first part of the letter. So till social background. Just study the letter. iPhone. Can you write your first name and second name, please? So we are starting the letter. Focus on what I am going to explain you now. Right. Here we have the letter. First, let us check what is the relevant information. What is the relevant information? Okay. First, we'll go to here, writing task. We have here name of the person to whom we are writing. This is a referral letter. So referral letter. Yes. This is a referral letter. And the person who is to whom you are writing is Dr. Banerjee. This is half name. And this is full name, Dr. James Banerjee. So we'll exclude this one. Then it is consultant cardiologist. It is here. It is also here. So this you can exclude now. Sanditon City Hospital. Sanditon. So these are the 4 lines that you have here. The 4 lines that you have here. That's very clear. Sure. Right. So now what you can do is you can take your notebook and write, okay, these 4 things. This is the address. Okay. This is the address. So, number 1, Dr. James Banerjee, then consultant cardiologist. Be very careful with spelling. Sanditon City Hospital. Ignorance will be excused, but carelessness will definitely be punished. Remember that. Okay. So be very careful. Sanditon. See, I made a mistake, but I corrected it. That's how you go. So this is Dr. James Banerjee. From here. Dr. James Banerjee from here, first line. Consultant cardiologist, second line. Sanditon City Hospital, third line. Sanditon, fourth line. That's it. These are the 4 lines you have to write. Next, after this, you have the date. Today's presenting complaint is this. These are previous visits. Multiple visits. 8th February, 8 o'clock. 8th February, 15th February discharged. 8th February to 15th February is in the hospital. Okay. And now 15th May. Today is 15th May. So that is the visit. This was admission because of cardiac problems. Okay. So now this is a visit because of complications, side effects. Because of side effects, complications. So this is a visit. So this is a referral letter. How do you know that this is a referral letter? Here also it is given, and here also it is telling. Right. And what is the purpose? Purpose is regarding review of medications. This is purpose number 1. And second one is ways to encourage lifestyle modifications. So there are two: review the medication and the methods to encourage lifestyle modifications. So these are the two things. These go to the purpose. And now, so you are writing the letter today, 15th May 2021. 15th May 2021. Yeah. So you can take the case notes. I'll give you here. Yeah. I already gave here the case notes, but the full sample I'll give you here. Letter number 5. This is Miss Eleanor Bennet. Eleanor Bennet. Case notes. Cardiac medication. Side effects. This is a referral letter, writing medicine, OET, authentic official materials, grand master class. Yeah. Yes, there is your letter. You can download from here if you want. Copy post link. If you want to download that, here it is. You can download. Yes. All right. So we are heading forward. Yes. So this is the date. All right. Next one is salutation. So we got the date. This is the date. Copy text. Okay. So this is finished. Then we are taking the date here. This is the date. This is how you are supposed to write. 1/5/15, May 2021, full. You have to write in full. Remember that. Then third one is the salutation. So you will take this title, Doctor, and Banerjee, second name. And before that, you will write a dear. Before that, you will take dear. Dear Dr. Banerjee, comma. Dear Dr. Banerjee, comma. This is what you will take. Right. Then afterwards, Dr. Banerjee. Yeah, like this. Dear Dr. Banerjee. Then next you have subject. Subject is here. Eleanor Bennet. That is Miss Bennet. Okay, Miss Eleanor Bennet. Remember, Miss you have to take from here. Eleanor Bennet you have to take from here. Okay. So you have to take all the things, all inclusive. So then date of birth is given and age is also given. So you can take any one you want, but when both are given, better to take date of birth. So now let us take the point here. Subject. You'll say regarding, colon, Miss Eleanor Bennet, comma, DOB, colon, space, 06 December 1975. So this is how you are going to write. This is the salutation. This is the salutation. Yeah. So four things we got them now. Once again, first one is, yeah, address. This is the address. First one is address. Second one is the date. Third one is the salutation. Fourth one is the subject line. So these are the four things we have got. These are before the body of the letter. Next, at the end, we'll take the closure, the closing remarks after the body of, this is before the body of the letter and this is after the body of the letter. Dear Dr. Banerjee, name, we know the name of the person. So then, therefore, what we write here, yours sincerely, comma, yours sincerely, and comma. Instead of dear doctor, dear nurse, dear manager, dear sir, anything else is there, then here you will write yours faithfully. Remember that. Yours faithfully. That is what you will write. Then sender's particulars. That is your particulars. So today's date is here already, 15th May 2021. Remember. Okay, here also it is there. Right. Now you have been Miss Bennet's GP, general practitioner. General practitioner. Okay, you are a general practitioner. Okay, any other address is there? This is the patient's address. Your address is not given. Name of the hospital is not given. Your name is not given. And your city is also not given. We don't know whether you are from Oakville or not. So if it is not given, just write GP. Okay, emergency hospital admission, Oakville General Hospital. You can see here, Oakville General Hospital. Okay. Oakville General Hospital. So this is how that was before, not now. He was admitted, emergency hospital admission in Oakville General Hospital. But this is, you are general practitioner. Okay. Right. So that's the point there. We don't know whether you belong to this hospital or not, because this is a recent visit. Discharged, admitted 8 February, discharged 15th February. And now today is 15th May, 3 months later. So information is not very clearly provided. Information is not provided at all. So all these things, whether you're a doctor, whether you're a nurse or a pharmacist, it doesn't matter. All these things which I have told you now are common. So remember that. Right. So we got the address. So you're going to write general practitioner. So you can write general practitioner, or you can write doctor. Anything you can write. This is also okay, or this is also okay. That's it. Anything is okay. So now we finished with these points. So the introductions and the conclusions, the starters and the desserts, both we finished. Okay, what are those starters? Now let me show you the points. So here it is. This is number 1. This is number 1. That is the address. Number 2, here is number 2. That is the date. And number 3, this is salutation. Number 3 is salutation. Number 4 is the subject line. So these 4 are before the body of the letter. And next, this is closure. This is point number 6. 5th one is body of the letter. This is point number 6. And then general practitioner or doctor. This is number 7. So total 7 parts you have. 7 parts you have altogether. Now I'm going to give you those 7 parts. The list of those 7 parts. The 7 components, we call them. These are the 7 components of the letter. These are the 7 components of the letter: the address, the date, the salutation, the reference, and the body, the closing remarks, and the sender's particulars. So these first 4 are the starters. These last 2 are the deserts. Now remaining point is there only the body for us now. Only the body. So we are going into the body of the letter. Right. Body of the letter. Now, so far, okay, is the explanation clear? Is the explanation clear? Okay. Is the explanation clear? Yes. Is the explanation clear? Just tell me so that we'll move forward. Yes. So now we are going to the main body. Yes. We are going into the main body of the letter. Yes. So here it will be today's visit. Okay, because this is emergency. That was heart attack. That was even more emergency. But this is present emergency. So you have to write about. Okay. All right. Now let us see here. Yeah, just go through this case. Now, first one is, here you can see some important things. Here you can see some important things. Okay. Now let us see here. So this was an emergency admission. This is very important and it is in red. Okay, emergency hospital admission. So that's it. That's very, very important. Emergency admission. So, but it was not emergency now. It is not anymore important now. Next one, he was discharged and 4 weeks off for gradual return to work and all these things. But now The presenting complaint, this is the presenting complaint, and that is side effects of captopril. Okay, side effects of captopril. These are important. Okay, these are also important. Right. Now let us see. So it depends. This is related to this. This captopril is given after this emergency hospital admission. Okay. So you can see here, medications, treatment on discharge. Captopril was a discharge medication. Discharge medication. Okay. It is discharge medication. If you listen to this lecture, it is equal to 10 letters you have written. Okay. So don't miss the session at any cost. Right. Don't miss the session under any circumstances. Right. Fine. Now let us see here very carefully. So this captopril is following this emergency hospital admission. So this is more important. So directly you cannot say he has side effects of captopril. So this was given because of heart attack. On discharge, they were given this medication. So first you have to write about that. So you have to write about emergency admission, and you have to write about this captopril medication first. Then only, so you have to introduce captopril medication here itself. Okay, right. Now coming to the point, how are we going to start this? Now here, first we are going to write 5 different paragraphs. 5 different paragraphs. Now what are these 5 paragraphs? Now let us see, let us judge this one. This is not an emergency letter. So the body paragraphs. The body of the letter. Okay. This is the normal discharge type of letter. Now we have to change here. Now the body of the letter. This is not discharge letter. Okay. Now these 3 paragraphs we are changing. Now the first problem is here. The main problem. The main issue. The main issue is a stroke. So this is the stroke. The stroke. And here, you can say the follow-up action plan which was given to you. Okay. The action plan, the discharge plan, you can say the discharge plan or follow-up action plan, whatever is given, the plan of action. Post-stroke, he was admitted and discharged, and these are the secondary problem. Secondary, this is the secondary problem because of, so now you had the emergency admission, that's the main problem because of stroke, you had an emergency admission. So this was an emergency admission. This was emergency admission. Yeah. First one is the emergency admission. Then this one is the discharge. Here the discharge. The discharge is done. And this is the post-discharge plan of action. Remember that. So this, what happened before discharge, it was admission. That's why he was discharged. Then after discharge, he is going on with this medication. So this is the discharge medication. So discharge medication was given. upon discharge. Okay. The medication is nothing but captopril. This is the cardiac medication. And the secondary problem is related to medication. And this is the side effects. Many people don't understand the organization. Okay. They don't even understand how it is organized and how it is made a system. So first one is the stroke, emergency admission and medication given. And discharge, this medication was given and he is continuing the medication. And secondary problem arises because of this medication, that is captopril side effects. So now, because of that, he wants to discontinue this medication because he is thinking that because of this medication only he is getting this problem. Because of this medication, he is getting into problem. That's what he tells. So on this count, you are referring him to review the medications. Review the medications. So now, why you are writing this letter? That is the purpose. You are writing this letter for a particular purpose. And the purpose is, he has a problem with this medication. He thinks that the side effects are because of this particular medication. Because of this particular medication, he thinks side effects. Right. So the purpose is side effects of cardiac medication. So review for, so you are asking for a review. Review of what? Medications. Okay, reviewing the medication. Why? What is happening? That's plus. The second one is, during this discharge plan of action, lifestyle modifications will be given. Lifestyle modifications. So medication plus recommendations for lifestyle modifications. Lifestyle modifications. Lifestyle modifications. You can take it like that. Discharge medication, captopril plus lifestyle modification. Medications and lifestyle modification. That is a plan of action. And secondary problem, he is not implementing lifestyle modifications maybe. He does not want to take medications. So that's why review of medications plus even, so how to encourage implementing lifestyle modifications, transformation. So methods for encouraging lifestyle modifications. For encouraging lifestyle modifications. LM. Lifestyle modifications. I'm writing in short form. Okay. Lifestyle modifications. Okay. So methods for encouraging lifestyle modifications. So see here, that is the, and conclusion also, it will be a repetition Not repetition, but rephrasing. The same introduction, rephrasing in a different tone. Reiterating. Reiterating. Now, what is the meaning of reiteration or reiterating? The purpose. That means don't forget. Mind you, don't forget. That means repeating. Not exactly repeating the same words, reiterating the purpose. It doesn't mean that you are telling the same thing here, but you are telling the same thing in a different angle. Reiterating the purpose. Repeating the purpose in a different tone. Change the words, change the style, change everything. And you have to use that. So I hope you understood what I was telling you here. You hope what I am telling you here. So how the body is divided into 5 parts. First one is the introduction. You have to mention what are the main problems here. The problems are related to plan of action, medication, side effects. Second one is lifestyle, not change. That's why you have to encourage. How do you know that? How do you know that? You can see in the task. You can see in the task here. So requesting advice and review for medication. Here he told plan. Here is telling plan. Referral to cardiologist, this is number 1. Review, regarding review of medication, this is number 1 purpose. Ways to encourage lifestyle. Why is he telling ways to encourage lifestyle? Because he's not listening. He is not implementing. He is not interested. Okay. 2 suggestions were given. Continuation of cardiac medication. Second one is lifestyle modifications. Those only are repeated here, you can see. You are writing a referral for 2 things. First one is medications are there. He's telling these are the problems, these are the problems. Of course, the symptoms. So now you have to review the medications and tell what is apt. Why is all this happening? Second thing is invent some ways or methods or manners to encourage lifestyle changes. I already told him, but he's not. So you have to encourage that same thing. Okay. So these 2 are repeated in the introduction and the conclusion, but reiterated. Reiterated. What do you mean by the word reiterate? Very powerful word. Maybe you might have heard it or not, I don't know. Okay. But whatever it is, we're not taking any chances. Reiterate. Reiterate is a very formal word. To say something again, once or several times. Once or several times. For example, you want to go out. It's night time. You are 20 years old. You are a young person. Outside there is curfew. Curfew, that means you cannot go out. Shoot at sight orders are there. And you want to eat a pizza or burger. And you want to go and get it stealthily. Something like that. Or you want to enjoy a party with your friend. And you want to skip outside. And you're silently, stealthily going out. Your father calls, did I tell you not to go out? Did I tell you not to go out? That means you're reiterating. That means already he told, and he's reiterating, reminding. He's not telling again, don't go out. He's not, first he told, don't go out. But now he's not telling. He's telling, what did I tell you? That's enough. Did I tell you not to go out? One hour back, you asked me permission, but I rejected. What are you doing? Close the door. Come and sit here. That's it. So, telling in a different way, the same thing is called reiterating. You should not use the same words. Should not use the same words. Modify the words, but tell the same subject. Subject should be stressed, stressing, harping on the same point, which I already told. That means, like a brass bell, you have to remind him. This is more important. That's the purpose. That's it. It should go again into the conclusion. If you are saying review, okay, review of medications. So you have to change it and write in the conclusion again. If you are telling about encouragement for lifestyle modifications, in the ending you say transformation of regular routine. Lifestyle transformation, lifestyle modification in the introduction, transformation of regular routine activities. That's it. So that's very, very essential. See, for example, when you go, you have your son and you are getting him or her married. You'll go with a card, wedding card. Then you say, hello, good morning, how are you? These are all what you call starters. And say, yeah, very nice. How come you came here? Yeah, my son is going to get married. My daughter is going to get into a wedlock. Here is the wedding card, invitation card. Then say, oh, really? How come? What's it? What is doing? What's your daughter doing? How is everything? How did you get this? All the things you'll discuss. Then say, okay, we want to leave now. We have more visiting cards to give, wedding cards to give, distribute. So can we take your permission? But remember, you have to definitely attend the wedding. Don't forget. The same thing which was told in the beginning, the ending, you're reiterating. That means that is more important. That is the purpose why you came here. So when you visit him, first thing you will tell him after the starters, after greeting, hello, how are you, what are... I heard, there is a saying, you know, they'll say, hello, salam alaikum, kefil kal, kubur khair, all these things to them. Okay, how are you? Good morning. How are you? Welcome. How are you? How is your family? How is your wife? How are your children? How are they? Everything they'll tell. Finally, they'll say, today we have a party. That's it. So, which is more important? That is the subject. General information is not that important. So, this purpose should be reinforced, strengthened. Now, what is this reinforce? Reinforce. Reinforce is a C2 vocabulary. Reinforce, to make something stronger. You know that this is the purpose, you should make it very strong, give a strong blow. Remember that. Give it a very strong blow. That's very important. Remember that. Okay. So the purpose are two here, purposes. First one is review of medications. Second purpose is encourage lifestyle modifications. Review of medications is required. A review of medications is required. Ways to encourage lifestyle modifications. Education regarding the methods for encouraging lifestyle modifications, lifestyle transformations. Education is required regarding lifestyle modifications. Change however you want. So this is the way how you can write the letter. Now let us see here how we are going to write the introduction. Okay. Here it is. Now who is the person here? Let us go to the paragraph. Let us go to the first page. Now here, Eleanor Bennet, Miss Eleanor Bennet. Start with Miss Eleanor. I am writing to request and all these things. I. Don't start with I. Many people write. But who is important? I is important? Or Eleanor Bennet is important? Or you are important? Okay, you are important or Eleanor Bennet is important. I am writing to inform you regarding Miss Eleanor Bennet. I am writing you regarding Miss Eleanor Bennet. I important or you important or Eleanor Bennet? Eleanor Bennet is important. Then why are you pushing her to the third place? Don't do that. Don't do that. Okay, I'll prove you. I'll give a proof for you. So let me take the sample letter here. I am writing to request your review of Miss Bennet. This is given in the OET official case notes. It is right. Did I say that it is wrong? I did not tell it is wrong. It is right. I am writing. Who is writing? I am writing. Yeah, that's right. I am only writing. That's what I am doing. Now I am writing this letter. And I am requesting your review. Of course, that is also right. Of Mrs. Bennet. Miss Bennet, right? But what is OET telling you? What is OET telling you? Is it a secret? No, it's not a secret. It's an open secret. Only the thing is you have a cataract that you cannot see. I am removing that cataract. I am your eye surgeon now. You have a cataract. Because of that, you are not able to see through. You are only seeing here. I am writing to request. I am writing to request your review. Now, I'm going to show you that this is right. You know that. OET is giving this. That means it is right. No doubt it is right. And everyone is writing like this. I am requesting, I am right, I am referring, I am transferring, I am discharging, I am request, I am updating you, I am writing to request you, I am, blah, 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 blah. But I tell you, don't write. Never start with I. You know why? Let us go to OET only. Okay. I do your operation in the name of OET only. I don't have anything. I am zero in this knowledge. I don't have any knowledge regarding OET. I take OET. When you want to cut a diamond, you have to take another diamond. You have to cut this OET with OET only. Simon sir is not a diamond. Simon sir is charcoal piece. So don't take Simon sir to cut this one. You take OET, which is a diamond, to cut OET only. That's it. I'm going to show you that. Yeah. OET. Writing. Active or passive voice. That's it. Now see here. We don't want benchmark. We want official OET. Yeah, here it is. Official OET. This is my one. We don't want my also. We want official OET. We cannot trust anybody. We trust only OET. So Okay, 1 second. OET my one. Okay. YouTube. Facebook. Okay, Facebook. Yeah, OET home. OET materials page 3. OET exam.home. OET exam.home. Yeah, let us check this one. This looks like OET, official OET, because they have changed the style a little bit. Yeah. OET winner online. This doesn't look like official website. Courses OET login. WordPress. OET will never have WordPress. Okay. On file download. Passive voice and OET writing notes. Which website is this? They have changed the site, that's why OET exam.home. Official OET, we'll just type official OET. Yeah. Change the style totally. OET.com. This is the official website. Instead of occupational English test, they wrote, yeah, passive letter writing. Yeah. Okay. So here we'll check passive voice and writing. Yeah, here he has given. Yes, of course, we got it. Do you know how to write passive forms correctly? That's it. So here he's telling, passive forms are great. That means active forms are not great. That's it. Passive forms are great. That means active forms are not great. I'm cutting the diamond with the diamond. Okay. For making the patient is important, or treatment is important, and you have to make it the focus of the sentence. Who is to be made the focus of the sentence? The patient should be made the focus of the sentence. The treatment should be using it. It means what? The passive form. Using it means the passive form. During writing and speaking, subtext can help your language be more sympathetic. If you say, I am writing this letter, that means you are not sympathetic. You are boasting about yourself that you are very great. Only you can. I am writing this letter means I can write the letter. Nobody else can write the letter. That is what it is. That means I am great. So that's what it is. As a nurse or a doctor or any other medical professional, you can use your language to build better relationships with patients. If you say, I will explain you the procedure. I will explain you the procedure. Now, I am important or you are important or the procedure is important here. Who is important? I'm only explaining, you only am explaining. But what is coming new here? The procedure. The procedure will be explained. The procedure will be explained. Finished. Why are you telling I will explain you the procedure? Procedure important, explanation important. I is not important, you are not important. The procedure will be explained. So instead of pitting the performer of the action, who is doing the action here? I am writing a letter. I am writing the letter. Who is the performer? I. So why do you want to bring I here? OET is asking you. If you have a cataract, I am removing that cataract. If you still want to keep the cataract, giving a deaf ear and a blind eye to me, that is your problem, not my problem. I tell you by default, I tell you here, you have seen in every message, I write here, the English language doctor. The English language doctor, because I'm doing that. Here I'm a surgeon for your eyes, eye surgeon. I'm removing your cataract. Okay, so you have some problem. If you are starting with I, that means you have some problem. So I'm trying to eliminate that one. If you remove this I, you will increase 20 marks automatically. And if you are using passive voice, you will get another 20 marks. So in every sentence I'm talking, not only in one sentence, almost everywhere if you remove, you can increase 40 marks. And if you write quality wise, it will increase by even 70 to 80 marks. This is why many people don't get marks. 10 marks for removing passive voice, active voice, 10 marks for writing passive voice. That is it. 10 marks you are removing your importance, and 10 marks you are adding importance to the subject of the sentence. So altogether 40 marks. Removing wrong things and putting the right things. I am writing, you write, or Mr. X writes, or Mr. Lionel Ramamurthy writes, or Miss Margaret Thatcher writes, whoever writes, it is not. The person who is reading will not even bother about you. Who is writing is not. Only if you see Mr. Simon is writing, you will do the treatment? No, no. Whether Simon writes or somebody else writes, you will not mind. You will mind what the patient has. Remember that. So, who is writing is not important. Who the patient is and what his problem is are important. So, focus on those particular areas. Focus on those particular areas. That's it. There is no excuse for this. Okay? Right. See here, I am writing to request. No need. Avoid that. Straight away. Yeah. So, Miss Eleanor, here it is. Miss Eleanor Bennet, comma, Miss Eleanor Bennet, comma, so now you can see here, you can make 3 sentences first. You can make 3 sentences. You can take this one here. Second page. Yeah. Miss Eleanor Bennet, comma, okay. This is first part. Okay. Blah, 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 comma. requires, no, is being referred. Is being referred. So Miss Bennet, Miss Eleanor Bennet. So you need not write full name. Just Miss Bennet is enough because Eleanor is already there in the subject itself. We already wrote Miss Eleanor Bennet, date of birth. So again, Eleanor Bennet, no need. Just one line before only we told, no? Okay. Just one line before only we told here. See here, regarding Miss Eleanor Bennet, just one line above. So no need to repeat that one. Okay. Miss Eleanor Bennet is being referred from here, referral from there, you take, is being referred for what? Okay, review of medications, for review of, okay, review of cardiac medication. That's it. Captopril is cardiac medications. Number one. And the second one, what? Ways to encourage lifestyle changes. Ways to encourage lifestyle changes is being referred for review of cardiac medications and encouragement for encouragement regarding lifestyle modifications. So now see how it is coming, how you are implementing it. Miss Bennet is being referred for review of cardiac medications, a review of cardiac medication, a review of cardiac medications. Or you can say, I'm changing, I will change everything possible. For expert opinion whichever you feel comfortable. Okay. So an expert opinion. So how you are going to modify this one, that is up to you. A review of cardiac medications and encouragement regarding lifestyle transformations. Okay. Or education regarding lifestyle modifications, or counseling regarding lifestyle modifications. So how you modify that one and write you right. And here, what is happening? What is happening exactly here? Now here you can see in the second page, presenting complaint. Who presented today with the complaints regarding side effects of captopril? Okay. Or who reports stress from side effects of captopril? Or who wants to discontinue captopril? Okay. Or who is reluctant to, okay, start new medications or discontinue, however you want, whichever is the best possible option, you can say. Counseling. See here, counseling given regarding lifestyle change. Already counseling given, but he is not implementing. That's why again encouragement of lifestyle changes. Counseling is already given. Referral for cardiac rehabilitation, non-attendance is not compliant. Non-compliant is not interested. He doesn't want to transform his lifestyle. Same thing again he is doing. She is doing. Okay. So repetition, going on with the same old style. So she wants to discontinue medication, which is already given here, captopril, and she is referral for cardiac rehabilitation session, no attendance, counseling given regarding lifestyle change. No, that's why he has to. So give him something in his brain. Both the things, review of medication plus lifestyle modification, both, because he is non-compliant. Okay. Right. Who has signs and symptoms suggestive of? He reports. He says that this is because of captopril medication. Okay. Now you don't know what to do. So you are sending him for expert guidance. That's it. You're sending him to a cardiologist, specialist, because you are a GP, general physician. You are not able to take the decision now. It's going out of your hands. So you're giving to, so referral to a higher authority who has a lot of knowledge regarding the subject. So Miss Bennet, okay, who presents today, who has presented today, complaining regarding the side effects of, or concerning the side effects, complaining about cardiac medication side effects. So that you can write like that. Okay. So who has presented today, okay, who has presented today with the complaints of, okay, or who presented today with the request of discontinuing captopril medication owing to side effects. Modify. There are 101 ways to write. Okay. Presented today with what complaint? What is the complaint he has? Okay. Or with the signs and symptoms. Who has presented today with the signs and symptoms consistent of cardiac medication, side effects of cardiac medication. Anyway, you write, but see that it is perfect. So that is how you are going to write the introduction. Right. I gave you a rough idea. Okay. Right. Next. So what happened initially, you have to write that. Here you see. Right. So now she is divorced. 2 daughters are there, 18 and 16, living with the father, under father's custody, which is contested in the court. So she has tension, a lot of tension everywhere. Okay. So she's taking alcohol, increased alcohol consumption, and smoking, body mass index overweight, and reduced regular physical exercise, little. Okay, so all these things. And father has died of heart disease, has a family history of, okay, heart disease. Older brother, mental health problems, suicidal tendencies, family history, mental disorders. Father, heart disease, but older brother has done two suicide attempts in the last 12 months. So this is also mental disorder you can see here. All right. Now here, this is the main problem, heart attack. From here only everything is developing. Okay. So you can start from here and emergency hospital admission. So what happened, all these things here, right? Balloon and expandable stent, all these things will go into the first paragraph. Then discharge plan. All this discharge plan should go into the second paragraph. So medications on discharge, this also will go into the second paragraph. Okay. Now third paragraph is this one. Presently today he visited with these things. Okay. What he wants is not interested to start new medication. He wants to discontinue this medication, and he is telling that the stress increased because of the side effects of this medication. Okay, then still this dizziness, light, all this is presented today with the complaints of this one, and he attributes all this to the side effects caused the stress because of the side effects, attributes to captopril medication, and then he wants, that is the reason why. So this is the reason. What is the reason? Captopril medication is the reason, and the effect is side effects. And now what he wants, the problem is side effects. So you want, what's the solution he wants to give? The problem is there. So he wants to give the solution, discontinue captopril. So problem, solution, cause and effect. What is the cause? Captopril medication is the reason for his side effects, results. And now the problem is results. What is that? Stress. He's getting stress because of the side. That is the problem. He doesn't want to take it. And the solution he wants to give is he wants to discontinue captopril medication and is not interested to take any new medication. She is not interested to take any new medication also. Actually, the thing is not this one. The thing is, he is not interested to take the medication, number one, and is not compliant with the rehabilitation sessions, and is not ready to implement the recommendations given while discharge, while being discharged after the stroke, after admission. So that's the main, these are the three main problems. Is not interested, is reluctant to attend the sessions, cardiac rehabilitation sessions, and is not interested to change her lifestyle. So this is the reason. So now, first paragraph you write about heart attack and admission. Second paragraph you write about discharge and medications and his everything related to that. Okay, whatever required, relevant information. And third paragraph you write about today's visit and what are his complaints and what he wants to do. All those things you write. And the conclusion, again repeat the thing. Based on the aforementioned circumstances, based in view of the above, comma, okay. Expert guidance regarding medications. In addition to counseling, already we have seen, education regarding lifestyle transformation, okay, would be profoundly beneficial. So the same thing in a different style we are putting. Everything changed as far as possible. So I hope it's very clear for you now. So is the information clear? Is the information clear? And just to give yeah. So this is the letter for the doctors, but there is no difference whether you are a doctor or a nurse. Sentences, we are learning sentences. Now what I'll do is the first part of the general thing, second part is the organization we have learned. Now sentences, third part is, okay, sentence construction. Okay. How many of you want to attend this sentence construction? Where did that go? Third point is sentence construction. So, sentence construction. How many of you are interested to learn the sentence construction now? We learned many different things so far. So, those who are interested, just type, okay. Just type in. Those who are interested, just type in. Yeah. Yeah. So fine. So many people said I am in. Very good. So almost 10 students have said that's really good. Now we are learning some sentences. Yeah. Sentence by sentence we will learn. All right. Yes. Take your notebooks and keep it ready. Miss Eleanor Bennet. Yeah. So we'll start from the introduction. Yeah. Introduction. Number 1. A. It is introduction. Okay. Introduction. Right. Miss Bennet has concerns regarding the possible side effects of cardiac medication. So Ms. Bennet has concerns regarding the possible side effects of cardiac medication. This is one sentence. The same thing can be written in another style. Ms. Bennet has concerns. Miss Bennet is concerned regarding the possible side effects of cardiac medication. Both are correct. What is wrong in that? Miss Bennet has concerns. Miss Bennet is concerned. So what is the problem? So both the ways you can see. Now here, you want to add another sentence. Miss Bennet, comma, who has concerns regarding the possible side effects of cardiac medication, comma, and you will move like this further. And here also the same thing, comma, who is concerned regarding the possible side effects of cardiac medication, comma. So you will go like this. Okay. Now here, I am referring. So change it to is being referred for number 1 and number 2. Finished. Now see how you are going to write. Any way you can write. You can write either that way or this way. Or you can say, Miss Bennet, who has presented today with the concerns regarding the possible side effects of cardiac medication. Write in this way also. Or who has visited today with the complaints. Write 101 different ways. There is no problem. There is no problem at all. So, how you are writing, that's important. Is being referred. Okay. Ms. Bennet was concerned regarding the possible side effects of cardiac medication. is being referred for a review of cardiac captopril, or you can say, here you can say cardiac medication, and here you can say effects of captopril. Any way you can change and twist according to requirement. Captopril, review of cardiac medications, not only cardiac, not only, sorry, for not only a review of cardiac medications, but also education about lifestyle modifications. So this is the way how you can write. This is one style. You can write any number of different styles. He is being referred for both a review of cardiac medications and education about lifestyle modifications or counseling, right? Right. So then you can also say remove both here. A review of cardiac medications as well as education regarding or in addition to. Okay. So anyway, you can modify that one. That's up to you in your hands. So this is the way how you can use one sentence. So how you are making sentence is more important. You have seen now how I have made sentences here. It's very, very essential. It's very essential. You have to learn how you are going to write the sentences. This is the introduction. Next one, B. The main concern. Main concern is the heart attack. Then only captopril, no? Main concern. So here you will write about what you will write about. You will write about the emergency admission. Okay. First one is the sequence. So she had a heart attack. She was in a flight. Let us take how it goes. Okay. So long haul flight. Long haul flight. She had a heart attack. Okay. Then emergency hospital admission. And then balloon expandable stent. So all these things. And then the medications are given. captopril, and atorvastatin. These two were given. Okay, these two were given. You can see these things. So you can write about these points. What are the points you can write here? Number one is a flight. Flight. Next is she got a heart attack. Okay. Then emergency. There's an emergency admission. What all points we have seen? Emergency admission. And after emergency admission, stent, balloon expandable stent. Okay. A balloon expandable stent. A balloon expandable stent. Okay. And then so this is number one. Flight. This is number one. Okay, heart attack. She was on a flight, long haul flight, very long flight, long haul flight. Hyphenation, very important. Okay, the balloon expandable, one word. Long haul, one word. Long haul flight, heart attack, then emergency admission to Oakville Hospital. Then balloon expandable stent was given. Then medication was prescribed. What medication? Captopril and atorvastatin. These will go into paragraph number. Okay. B. A, B, C, D, E. 5 paragraphs. Na? These are the things. Next one. Next one, C. C is plan of action. C is plan of action, post-discharge. Plan of action. Okay, plan of action. What was the plan of action here? The plan of action was, okay. So, what are the next paragraph points you see there? So, lifestyle modifications. Okay, lifestyle modifications. Rehabilitation sessions. Okay, lifestyle modifications. Rehabilitation sessions. What is this lifestyle modification? What are lifestyle things? What are lifestyle things? Let us go to the beginning. Social history, personal history. Personal history is here. So, now if you see personal history is lifestyle. What are the lifestyle things here? Number one. So, she drinks, she consumes alcohol. Okay. She consumes alcohol. Okay, alcohol consumption. Increased alcohol consumption, 40 units per week. This is one which she has to change. And she smokes 20 cigarettes per day. This is number two. Okay. So increased alcohol consumption from 10 units to 40 units per week. This is number one. And smoke cigarettes, 20 cigarettes per day. This is number two. And number three, she has a body mass index. She's overweight. She has to change this style. She has to reduce her weight. She's overweight. She has to reduce her weight. This is her lifestyle. Eats more and whatever. And exercise. This is the fourth one, lifestyle. Okay, once in a month she goes to the gym. Little exercise, once in a month. So these are the 4 things related to her lifestyle. Okay. So these are the 4 things in addition to what you have to write is. Number one is lifestyle modifications. Okay, lifestyle modifications. What are the lifestyle modifications you have to remove? Okay, lifestyle modifications are here. So lifestyle modifications. Lifestyle modifications. What are the lifestyle modifications that she has to do? Drinking. Drinking is number 1. The next one, smoking, is number 2. And number 3, BMI, overweight, number 3. Then exercise, number 4. In addition to this, there is a second one, that is rehabilitation sessions, cardiac rehabilitation sessions, which she did not attend, non-compliant. Cardiac rehabilitation sessions. So these are the things which she has to change. All these things she has to change. She has to stop drinking or reduce drinking, and smoking cessation is recommended. Weight reduction is advised. Exercise, increasing exercise, okay, on a daily basis is suggested. Then cardiac rehabilitation sessions should be compliant with that, okay, because she was earlier non-compliant. So all these sentences you can write. Number 4, I'm talking about sentences now, sorry. Next one is a D. Now what is this D? D is today's problem, current problems or secondary problems. Secondary problems. What are those secondary problems? Okay. What are those secondary problems? Now let us go to the case notes again. The secondary problems are here: dizziness and lightheadedness, headaches, episodes of diarrhea. So these are the things. Okay. And because of these side effects, so she reports increased stress because of these side effects. Okay, that's why she is requesting captopril discontinuation. This is the next one, because of the side effects. And she is not even interested to start new medications also. Discontinue the existing medication and reluctant to start new medications also. Both. Not ready to continue the present medication, not interested to experiment new medication also. Whatever, she doesn't want anything. So these are the things you can write. Okay. These are the things you can write here. Okay. And in addition to this, so you have to stress some more important things. What are they? You see here. Now let us see here. Family history of cardiac problems. So father also died at the age of 53, cardiac problems. Okay. Then next one. 2 suicide attempts here. Okay, brother, suicidal tendencies. Father died. So family history. Then brother has mental problems, suicide attempts, suicidal tendencies. Okay. And next, more importantly, is this stress, extreme stress. You see here, extreme stress is there, too much stress regarding worries about the quality of father's child care. She is worried about her family condition. So existing situations, current circumstances of the family. Okay. Current circumstances of the family. You can see here now. Okay. So these are the important things which you have to notice. Two daughters are in the care of the father, and she's worried about her family condition. She expressed that is the most important thing. Because of the stress, she is not ready to decrease alcohol consumption. She wants to increase alcohol consumption. Now let us see. Alcohol consumption, this is increased. Increased alcohol consumption. Now let us take about this sentence. This is the sentence. Okay. This is the sentence. Yeah. So, yeah. Increased alcohol consumption. Right. Increased alcohol intake, consumption, changing the words. Okay. By 4 times. Okay. Alcohol consumption in quadrupled. Simple. I'm changing the style. Alcohol consumption quadrupled. Now, what is this word quadrupled? Is it suitable or not? Let us check. Go to Cambridge Dictionary. Quadrupled. Quadruple means to become 4 times as big. Quadrupled means to become 4 times as big. See the quality of the word. One word is equal to this many words. To become 4 times as big, or to multiply a number of known by 4. Quadrupled. 4 times as big. Alcohol consumption quadrupled. So do you know this word? How many of you know this word? How many of you know this word? So, no or not? No. Okay. So if you know, type yes. If you do not know, type no. How many of you know this word quadrupled? Okay. I know doubled, tripled, but quadrupled you don't know. That's the point. Doubled is there. Okay, you know. Tripled is there, you know. But why don't you know quadrupled? Because you don't use that one. I'm showing you the Cambridge Dictionary. So how you are going to use this sentence? Alcohol consumption quadrupled from 10 to 40 units per week. So now what I am doing is weekly alcohol consumption. Now I am changing this one. Regular weekly alcohol consumption. Finished. See the quality of sentence where it has gone. Regular weekly alcohol consumption quadrupled from 10 to 40 units. quadrupled. Increased four times from 10 to 40 units. Okay. Now, quadrupled is enough. Put a full stop here because this is not important now. Put this in brackets. Who wants these units? Nobody wants these units. They're telling the intensity of that. Regular weekly alcohol consumption quadrupled, 10 to 40 units. Finished. Okay. Or you can even say from 10 to 40 units. Finished. That is in brackets. That's not important. The word which you are using outside of brackets is more important. Regular weekly alcohol consumption quadrupled, means increased by 4 times. What is there from the sentence? Only one alcohol is there. Other than that, everything is modified. Week is there, WK, weekly it became. Intake became consumption. Okay. 10 to 40 became quadrupled. Changed, modified. One sentence, finished. Okay. Right. So like this, you have to make some sentences on your own. Okay. You have to make one sentence on your own like this. Right. Then patient requires captable discontinuation. So now how we are going to write this sentence? Discontinuation of captopril medication has been requested. Now what I am doing is discontinuation. Now I am changing this discontinuation to cessation. Cessation means what? Ceasing. Ceasing means what? Stopping. Stopping means what? Discontinuation. To put an end. Do you know the meaning of cessation? Use it. Why don't you use it? Cessation means totally stopping. Ending or stopping. Why don't you use this word? Cease. Cessation. Okay. Ending or stopping. Okay. The ending of a condition or the stopping of an activity. The fact of something ending or stopping. What more you want? Cessation of captopril medication. Cessation of captopril has been requested. I'm saying solicited. How many of you know this word solicited? Solicited. Oh, spelling mistake. SOLICITED. Solicited. How many of you know this word solicited? What is the meaning of solicited? Let us check. Solicited. To ask someone for money, information, or help. Ask someone for money or information or help. To ask means requested. For information, to stop this one. Request. Permission. Request for permission. Request for information. Request for money. request for help, anything. Solicit means to ask for something. Ask for. Solicit means ask for. Ask for something. Maybe money, maybe information, maybe help. Okay. Or permission. Ask for permission. Permission was solicited. See the word. Huh? Only one Girija said, no, sir, I don't know. What about the others? You know them? Use it. Very good. So, cessation of capital has been solicited, requested. Okay. Now here I am saying not only cessation of capital has been solicited, but also a reluctance to commence new medications has been expressed. Stopping capital was asked for and reluctance to was expressed, has been expressed. In addition to cessation of capital, reluctance to new medications has been expressed. You can write 100 different ways. Okay. So I think counseling regarding lifestyle modifications. Okay. Relevant counseling or education, relevant information or relevant training or relevant education concerning or relating to lifestyle transformation has been provided. Write however you want to write, you can write. Okay. So I hope you understood how to write sentences now. So take one sentence. Okay. Stress from the side effects of capital has been reported, and therefore discontinuation of the same has been requested. Anyway, you can add these two sentences also. In addition to atorvastatin, captopril has been commenced. Okay. Concerns regarding the children's welfare, okay, or stress regarding the family conditions has been informed, reported, discussed. You can write like that. Okay, now, so with this, we'll close the session. We are going to Easter Sunday. So tomorrow is Sunday. So what you can do is you can work and you can write your letters and send me. And I'll be correcting the letters and sending you. So how was the session? You grade it according to usefulness, according to the benefit you get attained benefit. Grade it according to your benefit. 0 to 10. And it is very useful, then give 10. If it is not useful, give 0. If it is moderately useful, give 5. However you feel. Your right, your choice. And write what you learned today. And after 1 minute, I'll be closing the session. Yeah. So that's the end of the session for today. And good night, all of you.